Okay, so welcome everybody. So that's the first panel for the CONECT platform, the CONECT project that is subsidized by PICORI. The CONECT means cardio-ocular network of connective tissue disorders. We could have made connected and include the D. I just thought about that yesterday. So that's the first panel we will have with a range of different connective tissue and disease. And the main topic is cross-cutting symptoms and their daily impact. So I have here still the QR code for the survey. The survey will be open until end of March. So people can still go on it. And by November, we will have everything, all the results analyzed, and we will present it at the first webinar. I cannot present preliminary results today because then it would give a bias for the next people answering. But I think it's going well. We have over 70 people answered the survey, so we will have nice statistics. So what's the CONECT? What's the purpose of this project is to build a cross-cutting rare disease partnership among connective tissue rare disorders. Obviously, we are not going to gather the hundreds. There are hundreds of connective tissue disorders. We are not going to gather hundreds representatives of the diseases. And we selected diseases that are that have a link with really cardiovascular and ocular manifestations. But we are not going to study only cardio and ocular in this project. We will enlarge it to the main issue and burden that are in those diseases. But it was a way to select the disease, to restrain the number of disease that would partner with us. So the first goal is to address the common limitation and challenges of all those diseases, and we want to align the medical care with the medical needs according to the patient. So that's the main words in this sentence. We want to empower the patients with appropriate knowledge for an efficient dialogue with their clinicians, so that they will not stay in front of the physician and not be able to explain what they are feeling, what they are going through. And the last part is that in that section is we want to identify and disseminate specific and differential training for the medical staff confronted with connective tissue disorders. So the new clinicians that come there, they are not specifically trained for connective tissue. And with this project, we want to identify what exact technology and knowledge they need to be really accurate for connective tissue patients in particular. We want to be informed for the PICOR priority and PICOR SER. So SER, that's the research. In fact, that's a nice word for a new research topic centered on the patient. So the patients that are better equipped to dialogue and describe their manifestation will trigger attention to new aspects for research. For example, you can say, we are in cardio, you see your cardiologist, you see, but at the end, something that is important to you is fatigue. And which means that maybe the research has to go through ATP depletion, mitochondria, or I'm not going to go in science, but I mean, I want you to understand that if you can explain better your manifestation, maybe that can raise ideas to the clinicians. We want to give differential training that can identify gaps in outcome measurements or unexplored manifestation, as I just said, which would lead to a new subject of research. Also, because when the clinicians are together and say, okay, I'm going to measure the artery there and there, but there is no good way to measure it. We need a new way, we need a 3D, we need something. So that can trigger also, by those discussions, we can trigger also new research topics. So the very short-term objective is to use virtual convening like this one and listening to patient's voice to explore the patient needs and answer the challenges and make proper medical decisions. We want to use experts, clinicians, their analysis to create the content of master classes just for the clinicians or caregivers. And creates a partnership and disseminating platform, including interactive webinars and a hotline to share observation and information. So the word that is important there is interactive. So that's the idea of the project, is really to have a kind of loop and feedback, that we start with the patient survey like we did already, and the panels, the convening. On the other hand, we start with the clinicians making SWOT analysis, so that's strengths, weakness, opportunity, and threat analysis in their techniques and in their knowledge. We have a literature review, and then those data go through the filter of cross-cutting analysis, so what is in common to all those different manifestation, different disease, and the goal is to improve the care, educate, and identify new care. So that's the filter from the data, and then it goes at the end. What we want to achieve is to have education of the clinicians and the patients, and create new care. From those webinars and masterclass, we want them to be interactive so that new questions come. And then we have a feedback loop, and those new questions go again through the filter and go back to and create new classes, new webinars. So as Andrea mentioned yesterday talking with Kate, is that there is this 2 years grant from PCORI, but the idea is to have really a continuity and a self-feeding source of new ideas and new questions, so that this structure should last, in fact, longer in time. Am I right, Andrea?
Mm-hmm. Absolutely.
So the impact we want to have is still, so I insist on the interactivity of the model that will allow adjusting the focus and the cross-sectional issue in similar rare community, so that we want to address the patient needs and evaluate the PCOR priority and lead to CR. So really the interactivity is extremely important to us. The platform will have a direct impact on awareness in the clinical community, of course, because we do masterclass, and an indirect impact through the increased ability of the patients to advocate. We want to implement new research thanks to that. And this new study will lead to more information on the rare diseases, leading to a stronger rare community that can make more informed decisions on their healthcare and increasing quality of life. So it's really this feedback loop and feeding from one another that we want to have this spirit in the project. So today it's the first panel, and we will have people with different patients with different, or patients parents with different disease. And I would like you to, one after another, first to introduce yourself. Andrea is going to introduce you generally first. And I would like you to genuinely share with the others your experience in 4 different aspects. The first one will be what impacts you the most. The second, what worries you the most, still in relation to your disease, not about the war in Ukraine, of course, but specific activity you cannot do or do fully because of your disease, and how it varies from day to day or week to week. So those who are familiar with PFDD, that's similar to FPFDD, that this first panel. So you can also, if you combine the survey and this exercise we do today, you can have that as a PFDD for your organization. The next panels of I think in 2 weeks, and then 2 weeks later, the second panel will be more about what you expect from a treatment, how you deal with your treatment now, and what you expect and what you are ready to go through for a new treatment, which is more giving indication to the FDA about, and the pharmaceutical industry, about how your patient community is involved and ready to be part of a clinical trial, and which kind of clinical trial and which kind of medication. So that's what we call the target product profile, which is part of the second panel will be more part of that. The third panel is really on knowledge and your interaction between the physician, the clinicians, and yourself. So I will leave the floor. Is there any question now? Or I think there are people that join a bit later.
Yeah, there's quite a few people that are messaging me that they're going to be joining intermittently. So you might hear the ding. I don't know how to turn it off, so I apologize.
No, that's okay. So what we can do is that we can start, and at the end I can go through the slides again for the people who wants to. Okay, so I'm gonna stop sharing my screen, and Andrea, I let you introduce people.
To start, I'm Andrea Taylor. I'm the president and founder of A Twist of Fate. We started back in 2014 because my youngest son, Aiden, had 2 pneumonia type illnesses back to back and was hospitalized. Then we ended up doing the MRA and found the severe tortuosity. One thing led to another. He ended up in the cath lab and back into surgery for pulmonary patchplasty, where they open the chest, removed the hairpin kink and connected all of his tubing back together, basically. And so we moved on from that. He's had several heart caths. He has 3 stents placed. Arterial tortuosity syndrome is a rare connective tissue disorder, and so that is one reason why we wanted to create the CONECT project. We were trying to find answers for ATS, and we knew that there was larger groups. We want to participate and work together with all of the similar like conditions of ATS to try and help find the answers for all of us, and not just ourselves. Of course, the original reason was because we wanted to find out what other researchers were out there. We wanted to find out, what other programs were available, see what we weren't doing right for our own patient population, and to kind of learn and really just connect with each other. And so that's why Armel and I created this project, was to help bring all of those things together for everybody. So this project is much more than just the survey and the patient webinars. We really are trying to build a community here to help bring all the patients together, because alone we're pretty small, but together we are a big community. So that will allow us to look at the similar conditions, see where the similarities are, and then go for maybe bigger grants or bigger research projects to help push our individual initiatives along further, and a group initiative. So I just wanted to give a quick introduction. I know I've not met everyone before. So next up, I would like to, Armel, you have not introduced yourself correctly yet, ma'am. Would you like to do that?
I'm so sorry. Yeah, so I'm Armel Pindon. I have a PhD in neuroscience, and my background is in neuroscience and pharmacology. After my postdoc, that was I started my career in spinal cord injury and myopathy, and then I went to pharmaceutical industry. where I led several drug discovery projects, and I was the head of cloning and expression department at Janssen Pharmaceutics. And then I had a break in my career because I have a son with a rare disease, and my dad died at the same moment from a rare disease. And then I turned to rare disease, of course, brought by my own experience in life. So now I'm the president and founder of a 501c3, a nonprofit organization that is called Plan for Rare, where I help small rare disease organizations do their strategy, scientific strategy, and drug discovery, how to get a treatment, because a lot of small organizations really don't know and rely only on one or two scientists that are not specialists in drug discovery. So I help them with that. That's the reason, that's the way I met Andrea. And at the same time, I'm the scientific director of Cure VCP disease. So like from Monday to Friday, that's my daily job. So that's it. The VCP is a disease on neurodegeneration and myopathy and frontotemporal dementia also. To you, Andrea. Did I forget something or?
No, she's just absolutely pretty fantastic and amazing. And I would never want anyone to steal her away from us, because she's such an important aspect to everything that we do. But I definitely would have conversations as a patient group leader with her, just to kind of see where you're at. And she's definitely worth every bit of effort that you could put towards getting her in your corner. So there's your free plug, ma'am. So no, actually, she's actually fantastic, and I couldn't be doing a lot of the things that I'm doing without her, Sky, and Jade. So I'm very thankful.
Stop it. That's okay.
So Nicole, you are going to be on our panel. Would you like to introduce yourself?
Hi, I'm Nicole. I am currently a junior in college, and I have Marfan syndrome. So do my mom and my sister. So we've all kind of had some experiences with like the varied aspects of Marfan, and have all kind of been involved in patient advocacy for, well, most of my life, thanks to my mom. It's a little bit about me, and it's really great to meet you guys, and I'm looking forward to having this conversation.
Thank you very much. Very nice to meet you, and we're happy to have you here with us. Kate, can you tell us a little about yourself and what condition you're representing?
Yes, hi everyone. My name is Kate Weirs, and I represent the Myhre syndrome community. I am mum to Josh, who has Myhre syndrome, a connective tissue disorder. We're all here for that reason. And we'll talk a bit more about what Myhre is in a little bit. But I also am executive director of the Myhre Syndrome Foundation, having got involved as a parent on the board a couple of years ago, and now in a position to help move the organization forward. So yeah, really excited to be here with you. I met up with Armel and Andrea just yesterday, so I'm quite new to this conversation, but in this group, but I'm incredibly excited about what it can achieve. So thanks for having me.
Thank you very much for joining us. We're excited for the potential partnerships and things that we can do together as a group. I know that we have Miss Maya. Are you available for an introduction or?
Yeah, I'm here.
Okay.
I have my camera off because I'm a bit of a mess this morning, but I have Marfan syndrome, as does one of my sons. And I have been involved with the Marfan Foundation in some capacity or other since I was 13 years old. And I'm currently in a genetic counseling program to be a genetic counselor.
We are very excited, Maya. You are quite the go-getter, and I know that you're going to inspire everybody that you work with, because it's absolutely amazing what you're doing, going back to school to give back to the community and to your family. So kudos, ma'am, is not easy being in the master's program because I am myself. So I totally understand. We have, I don't know if some of the others would like for me to introduce. Sky is our treasurer and the very, very amazing person that keeps me under control and in line all the time. And if I'm getting too excited about something and I get too far ahead of myself, she's always the one that grounds me back to zero where I should, reevaluate what I'm doing. And I don't know if she would like to introduce herself. She may be on the call, but on and off with her family.
I'm here. I'm happy to do a quick intro.
Fantastic.
My name is Sky Collins. I've been on the board of A Twist of Fate since 2015. In 2021, my daughter was actually diagnosed with Milan syndrome, which the research shows that, has a possible connection to Marfan-like connective tissue issues. So I'm excited to learn, and I'm really excited to be a part of the team.
Well, we are very excited to have you on, and I'd love to see how we can work with Mylan moving forward and helping you guys get some things accomplished too. We also have Ginger Knapp that has joined us, and I'm not sure if Ginger would like to introduce herself.
Oh, sure. Are you able to hear me okay?
Absolutely. Thanks, Ginger.
So hi, thanks for putting this together. It sounds like an exciting new adventure for us to be on together. My daughter was diagnosed with arterial tortuosity syndrome. The year is slipping me. I think that maybe 2018-ish. It feels like eternity. And from that moment, I was able to connect with Andrea in A Twist of Fate, and we've had some fun adventures together in some various clinics and cities, and I'm looking forward to see what this next adventure brings. Great work on this and great presentation so far.
Thanks, Ginger. We're really excited to have you a part of it, and we always send our love for sure. There's a couple of other people that have joined us, but I don't think that they would prefer to give introductions. They're here for support, and we're very grateful for them. If I left anybody out that would like to give an introduction, I don't want to hinder anyone from doing so if they'd like to. Okay. I think it's safe to move on. Dave said that he would be on in just a few minutes. So I think it's okay, Armel, for us to go ahead and move to the next portion, just to be respectful of everybody's time. And when he jumps on, then we can move forward.
Yeah, so I would say that we start with the first testimony. I have Kate on my list as first. So I would like to know what impacts you the most for your child, preferentially, and also your family.
Sure. So just to give a little bit of context on Myri, Myri is a de novo presentation. It happens by chance, point of conception, and it is a progressive, but also a spectrum disorder. So you can have people in our community born with very complicated and complex congenital heart defects, but then you can also have people who much later on in their lives acquire cardiac problems. So we very much are on a spectrum. We're very much on a progression in terms of stiffness, stenosis, fibrosis. So that kind of leads me into what impacts Josh right now. So he wasn't born with a congenital heart defect. So he was diagnosed at 2 years old just because we had been monitoring his growth. And one of the symptoms or characteristics of Myri is that they have short stature. And I had noticed that he wasn't progressing. He just wasn't growing out of those baby clothes. And I started to monitor that myself because at the time, I think I was seen as one of those over cautious mothers. But when I had the data myself, we then talked about what was happening, and then genetics was talked about. We fast forward and here we are with the diagnosis. So for him, short stature, I would say, is something that features right now. For him, physical activity compared to his peers, he is very small. So things like it's your basic
being able to climb up onto play equipment, being able to climb the stairs. We can share later, I can share with you like kind of what a typical Maori person, excuse me, might look like. But if you can imagine kind of small, slender legs, there isn't much. I always joke as a baby, Josh was never one of those kind of cute, cuddly rolls of fat babies. He was lean and felt stiff in terms of his movements of muscles. So physical activity impacts him in terms of his strength. So I guess that's twofold. It's his endurance is something that we notice, but also then his physical ability to be able to climb on things, to do things. At school, he's lucky to have some adapted physical education. So because some of the equipment's too big for him, right? And also they've had to find some pedals for him that are much smaller and in a different position, just, you know, that kind of thing. Activity side of things in the short stature, I would also say what impacts him most is his speech. Development delays are very, very common with Maori, and speech delay is one factor of that. So it's difficult for him to be understood by people who don't know him well. It is getting better, and he's been in speech therapy, which is great. But again, that impacts on the social side of life and his ability to interact with his peers and join conversations and have appropriate age conversations. I mean, I know that sounds silly, like more appropriate age conversations for 5-year-olds, but they do have them, right? They're having lovely chats, and he might come in and just go giraffe and then run away. And like, so he's very excited about life and he's very excited to be included. But the chit chat of the classroom stuff, I can notice that he is a step away from their kind of social awareness and that kind of thing. And I think that development delay gap will continue as his peers might move forward. We know development delays with Maori syndrome basically affects 100% of the community to some degree. But we're obviously there. He's in mainstream school, he's in TK, and he's being supported. So, you know, that's great. And he's an extremely happy boy. And yeah, he lights the room up. So I hope that kind of answers in some way the impacts most section. I guess worries most, gosh, as a parent and as anyone who gets a diagnosis of any condition, you think about the future. For us, we think about premature fatality. With the cardiac side of things, that's our biggest worry as a community as well. I've lost 3 young people in the last 3 months, 2 7-year-olds and an 8-year-old to Maori syndrome. So that is a huge concern for our community. And something you're all aware of. You know, I also think about in terms of not just the physical side of his life and what might happen with his heart in the future, but also, you know, what life he is going to have and what the future looks like for him, because, you know, that has extra parameters around it that are unknown right now for him because of the progressive nature of Maori. You just don't know quite what's going to happen. So as a parent, that is, I mean, anyway, I'll hold my hands up and say, I like to know what's happening in life. So, so then having that as something to deal with is unsettling for us. And obviously from my Maori Syndrome Foundation Executive Director hat, congenital heart defects and heart defects for people we're losing in the community is obviously incredibly important, front of mind. And we're doing all we can with some research that we've started ourselves into the cardiovascular manifestations, which we can cover another time. I appreciate, because this is the patient side of things, but just wanted to let you know that that's happening. Activities he can and can't do, I've touched on, like he's not at a stage where he can cycle, not necessarily meeting those physical milestones that you might expect right now. So things like riding a bike. He's just starting to look at using a balance bike, that kind of thing. But through to also with connective tissue in particular, he finds it quite difficult with finger strength and finger flexibility classroom. So we are looking at keeping an eye on that, and then looking at maybe having some adapted technology to help with that, with fatigue. And this is something, again, that's very common in the Maori community that's reported back, is that the Maori children have the desire and want to get writing everything down, but they get left behind in terms of their speed in being able to use their fingers in a dexterous way so that they can then keep up with the class. So that's, you know, it's not that it's not there, it's just that you know, the fingers aren't allowing it to get down in the right amount of time that might be dictated by the class. So they are the main activities and things that he is struggling with right now. And day to day, week to week, I would say as he gets older, I think, you know, you're seeing those social skills, the development gaps. Those are the things that I am mindful of and thinking about and seeing when he is interacting with peers. It's fair to say you might, if you didn't know Josh, think that he is 3 and from just a size point of view, but also then from a development point of view, you might fit him into that category. So again, that then shows where he's gapping with his peers. And, you know, you mentioned fatigue. Yes, he will, after a certain amount of exercise, you know, want to be picked up or to sit down or want to have a rest. Now, always in the back of your mind, you're like, oh, is this, you know, because some of my other mum friends will say, oh, no, my child would always prefer to like have a piggyback as well. But, you know, there are considerations there around his fatigue level as well. And I would say what we've seen from the community as well is as the children get older, lung capacity, pulmonary function definitely impacts their ability to do sport and to enjoy what they used to do. So walking, running becomes much more restricted. We have people using wheelchairs, we have people using walkers to aid them. So lung function, and that obviously comes from the pulmonary cardiac area as well. And again, we can get more into the technicalities of that if you want to in a future date, and I can have other members of our boards come on to panels and share with you exactly their experiences too. But I mean, Josh is obviously quite young. He is 5. He didn't, as I say, be born with any of the congenital stuff, but for us, it could be on the horizon. So there's kind of just a quick whistle-stop tour of some of the things that are featuring in our life.
Sorry, I had to jump on the mute button. Thank you so much, Kate. So I think one of the worries that is common to every, not only connective tissue, but every parent in rare disease is the uncertainty of future. That's something that has to be taken into consideration, and we are making efforts with, I think, Andrea, but also with other organizations to develop the mental health parts of the support for the patients. But that's something else. So I saw that Dave, who's on the panel, also join us. If you could, sorry, David, I don't know how if you signed Dave on your emails, but
either way, it's fine.
If you could introduce yourself, and just to precise, if the others that are not talking can mute their audio, that would be nice. So David, if you could introduce yourself, and do you want after that to go on with the questions on what impacts you the most and worries you the most, and specific activity you cannot do, and how it varies from one day to another. I think, Kate, you didn't answer that question. We can go back to you after.
Yeah, I wrote the questions down, so I'm fine. Yeah, I can keep it fairly short. So anyway, good morning from Boston. Which is where I am. In this case, I am the person with cutis laxa. Actually, my sister and I both have cutis laxa. That in my case wasn't diagnosed until I was 60 years old. So I knew I had some problems. So I was born with congenital heart problems, as was my sister. We both had open heart surgery. They waited until we were 5 to do the repair. And I guess it's a good success story that I'm here in front of you at the age of 75. So that says you can make it. Of course, I didn't know it was genetic the whole time. And so I had a very active life, and things worked for me. I was actually a Navy pilot, so I was able to pass all kinds of physical. I don't know why or how. Or I couldn't do that today. Being diagnosed, they would never let me do that, but I didn't know any different, so I did. Anyway, when I turned 60, I got pneumonia, and I had other respiratory things along the way, but just dealt with it. Didn't know there was anything else. Never imagined that it might be genetic. But when I got pneumonia, I had a chest X-ray, and they discovered that I had a large ascending aortic aneurysm. At that point, it was 4.2 centimeters in diameter. So, so fortunately, I got diagnosed before it dissected, and I lived with that for the next 10 years. It turns out that I also had my sister get an echocardiogram to say, I wonder if she's got the same problem. She has the same aneurysm. So anyway, it finally grew to 5.1 centimeters in diameter. So they replaced my 2.5 inches of my aorta last February. And so I'm still going. The result of that is I can still physically do the things that I've always done, but I'm lightheaded much more often than I ever was before. And I also get tired much more easily than I did, but some of that is certainly age manifested as well. So what impacts you the most? I think probably the lightheadedness. I actually had one episode where one of the things that I do in addition to flying is I like to sing, and I'm in a choral group. And I was 3 weeks ago doing a solo, and I got up to do the solo and I passed out. So that was kind of ruined the solo. Don't know where that came from. I've never had that happen before in my life. And it's like, well, welcome to the world of connective tissue disorders. So I think it was just from the lightheadedness, and I was also getting a case of the flu just to add to the fun. So that's the first episode I've had. Other than the result of the surgery, I have arrhythmia, so I have a problem with racing heart from time to time. Medication seems to correct it, so it hasn't slowed me down a lot, but I'm aware of it. And actually I have an Apple Watch that monitors my heart, so it tells me anytime I have an arrhythmia, believe it or not. So I haven't had any episodes in about 3 months, so that's all good. What worries me the most, I think, I worry about my sister more than myself. So my sister's aneurysm is smaller. We think mine is probably accelerated because of my flying and being a fighter pilot and all that kind of stuff. So we don't know how fast the aneurysm grew because we didn't figure it out until I was 60. So it was growing right along. But my sister's is much smaller, and she's being treated with losartan, which reduces blood pressure. And there's a high likelihood that she will never have to have this follow-on surgery. So I feel good about that we found it soon enough that her aneurysm is stable, and hopefully she won't have to go through this open heart surgery thing that I went through. Specific activities you can't do. I can still do everything I ever could do, but just not as often and not as long. So I have to rest a lot more than I did before. I still walk about 3 to 4 miles a day. I'm not good at running anymore, but I'm in reasonable shape, so I can do walking activities. My coordination is good. My balance is good. Other than being lightheaded, I just have to, anytime I've been sitting, like when I leave this meeting, when I stand up, I'll have to hold on to something for probably about 10 seconds, and then I can do whatever I want to do from that point on. So anyway, that's my story. I'm fortunate that my daughter, Dawn Laney, is a professor and a genetic counselor at Emory University. I'm actually her patient. So she's the one that did the exome study and diagnosed what my problem was. So it's kind of fun to be working with your daughter again, I guess. And of course, we've all been genetically studied. So that was our Christmas present one year. And I'll just tell you this quick anecdote and then I'll get off. My daughter came home for Christmas several years ago and said, I took this course at Emory in phlebotomy, and I'm going to draw all your blood and we're going to get you exome. So all of the family sat under the tree and bared their arms to my daughter, and she drew blood. And that's it's kind of interesting. So I was sent to Johns Hopkins. They do a lot of connective tissue work there to try and figure out what I had. They figured out it was connective tissue, but even after doing the genomic sequencing, they couldn't figure out what I had. So they thought it might be Marfan's or it might be Ehlers-Danlos. They went through all of those and said, no, you don't have any of those. And it took about 2 more years, and then they reanalyzed the genome and figured out that it was cutis laxa. So that's when I found out. I've also been in the study with at the University of Pittsburgh. So I was one of the early people that they studied there with a lot of the children and whatnot. So I'm kind of the other end of the spectrum, I guess. So I'm happy to be here. I'm happy to be anywhere. So
that is such an impressive testimony for sure. Thank you so much for being on, and I'm sorry for the quick emails this morning, but we're very grateful to have you. And
well, thank you.
That is quite a story with your daughter being a genetic counselor. I work in genetic testing, so it's very interesting to see how your diagnostic odyssey has kind of come all to fruition. And our Maya, who is also on the call, she also has Marfan's, and she is going to school to be a genetic counselor right now. So it's a great field to be in. Well, thank you so much for sharing. Armel?
Sorry, I'm here. Just need to unmute every time. So I think the next person on the panel is Nicole or Maya. I don't know which one did you choose from. Marfan, I think Maya wanted to be on the panel or on the next panel. Andrea, did you understand if it's Nicole or Maya on this panel?
I think let's go with Nicole, and if Maya would like to join in at some point, that's fantastic.
Okay. So Nicole, it's I'll ask you to answer also what impacts you the most, worries you the most, and what specific activity you cannot do.
Of course. So sorry if you see me moving my head and my neck a lot. Thanks to lovely Marfan, I have like a nice little spasm right here. But I guess what impacts me the most on a day-to-day basis, pain and fatigue, which kind of go hand in hand. I've dealt with chronic pain like ever since I was pretty young. It was mostly in my back. Then I had a spinal fusion surgery. It kind of changed after that. And then, yeah, just kind of generalized joint pain, like knees, hands, shoulders. I have like some like dislocations and subluxations. That kind of goes into the like depending week by week. Some weeks are worse with those joint issues. And then I guess kind of the other part of the question, even though I don't want to add too much to my answer, it hasn't been studied as much in Marfan, but I struggle a lot with GI issues. So lots of like nausea and stomach pain type issues that I have a feeding tube right now after like several years of like different tests and procedures and such. And we're not sure exactly how it's related to Marfan, but I think it is because it's just some issues with the way my stomach like works or doesn't work to let food through. So I would say that impacts me pretty strongly given I have a feeding tube. I'm so sorry, my cat is making a mess in the background. I'm trying to not have that much noise. Here, bring me the little criminal. Maybe she'll calm down if she gets to see everybody. This is Tina. But yeah, those are some of the things that impact me most daily. Like I said, you know, it varies a lot day to day or week to week, whether my pain is worse. Some things that impact that are like the weather here in the Midwest. The cold weather really makes my joint pain a lot worse. So I tend to do better like in the warmer time of year. Let's see, was one of them what I'm like most worried about? Okay, so what I'm most worried about is definitely what pretty much everyone here said is the cardiac aspects. I also, I had a friend pass away really suddenly last year from Marfan, even though like her cardiac issues weren't that severe. And like for most of my life, my mom like had like very mild heart issues, but all of a sudden they progressed quickly and she needed heart surgery to have both for both her aorta and her mitral valves. So that kind of worries me, you know, just like if I'll be stable for a while and then my heart will get worse or it'll be fine and something will happen, as well as just I worry a lot about how aging will impact my struggles with pain and fatigue, because it's already kind of an uphill battle to be a full-time college student dealing with that. So yeah, I'm very sorry if I missed anything.
It's just that I would like to for you to share more about the things you cannot do fully and how
Okay.
it
Yeah.
interact with your life.
Yes. So I can't walk very long distances. A little bit because of pain and fatigue, more just because of like dizziness. So when I walk, I usually use a cane to help, or for longer distances, like when I'm at college, like going to my classes, I use a wheelchair. I had been in physical therapy most of my life to try to help with some of the muscle issues, but at that point, it's with Marfan a lot of the time, it's more about maintaining what you have rather than like getting stronger. Um, and then stuff I cannot do. Also like when I like do things like taking a shower or like washing dishes or cooking, things like that, I usually have to be seated while I'm doing them. And because of Marfan, I've never really been able to do like sports or anything. One, because of symptoms, but two, because of the cardiac concerns with it. So I would say that's what impacts me the most, for what I can or can't not do. And then just kind of related, is because of my stomach issues. I eat a little bit by mouth and stuff, but I usually am only able to eat small meals. So like if I go out to eat with friends or something like that, someone cooks to me. Sometimes I can't eat, sometimes I can eat just a little bit. And I usually have to like carry a backpack with my like formula for my feeding tube and stuff like that.
Nicole, thank you so much for sharing your story. You're very courageous, and I know that's very hard. I cannot even imagine some of the things that you go through. What's it like? Do you mind me asking a couple of questions?
Go for it.
So what is it like taking care of the feeding tube yourself, or do you have a team that comes in and helps you, or?
Yeah, so I mainly do it myself. But sometimes when I'm having bad days, I do have like my for my personal care team that I get like hours for from my insurance. I either have my mom or my friend help me sometimes. But usually I just it's very small when it's not in use in my stomach. It's just like a little button style tube so it doesn't dangle. And then I have like the cartons of formula that I just keep in my cabinet, and I will like take my bag out for the formula. I'll pour in 2 cartons and I will connect it to the pump. So I got like a special backpack so I can carry both like the pump and all the stuff I need for my day at college, my laptop and stuff. And usually because I can't tolerate like high rates of the feed, I usually run it for like several hours at a lower speed. So honestly, it is kind of hard to manage that. Even when like physically I can do it, a lot of the times, like mentally and emotionally, I'm very drained from like having to deal with that, and I don't do it as often as I should. Which is, it's, the steps by themselves aren't that hard, but it's more like the kind of medical process I've gone through to get to this point. I like deal with PTSD and medical trauma and stuff like that from like, being very dismissed by a lot of doctors because I am a young woman. So sometimes even though like the steps to take care of the feeding tube are easy, like prepare formula, flush, plug it in, go about my day, it's harder mentally to get myself to do it because I just have a lot of emotions around it.
Thank you so much for sharing. I know that that's very intimate, and I do really appreciate it because I think it will help us better understand what we're facing as a group in daily life. I also wanted to ask a little bit, and this may be the next section, so I'm going to be asking ahead, but with you being in school, how does that affect your classes? Are you doing online, or are you going into class a lot?
I go in right now, I go into class every Tuesday and Thursday. But in the second half of the semester, I'm going to be going every day. So it does affect it. I have accommodations through my school to, give me like more time to miss class or more time for certain assignments, but it is very challenging. A lot of what interferes with me going to class is it's usually the pain, fatigue, or brain fog. All those three things make it really hard. And like once I'm at class to really be focusing, or like if I'm having a really bad nausea day, I'm trying to focus on what's happening in class. But like all my brain can think about is, wow, you really don't feel good. I want to leave, but I'm trying to push through. So I am going to class full time right now. I have like a minimum course load for my classes themselves, but then I am a teaching assistant and I'm also doing some undergrad research with one of my professors. So I kind of have a very full load. But I will say when I have taken like medical leave from school before, when I haven't had a choice because of like medical procedures or things, I've honestly, that's been worse for my mental health, not being in school. So even though it stresses me out quite a bit, it's like something I enjoy. And that's worth it to me.
One last question. I promise I will let you
Yeah,
go
you're
to the
totally
next.
fine.
That is something that, and I don't know, maybe other communities know more about it, but it's not something that I know very much. I know about IEPs and 504 plans for students that are in like the lower edge, like pre-K through 12th grade. What's it like having, how did you go about getting the system in place for you in college? Because I don't think that's very talked about in the communities.
It definitely isn't. And it was, when I was going to college, I relied on like talking to other people with chronic illnesses and disabilities in college. So you don't have had to have accommodations when you were like a 504 plan or an IEP to get accommodations in college, but it definitely helps streamline the process because they can refer back to your plan and see what accommodations you had. So there's like a disability services office at every college, except for college, it's not under Section 504 like it is for like IDEA for lower education. It's kind of under a different section of the law. And I'm not the expert on this. My friend who is probably shaking her head right now, being like, Nicole, you got it right. But so you go to the office, you usually submit some kind of documentation from your doctor saying like, this is what condition you have, and these are some of the things that it can impact. It really depends on what your relationship is with your doctor, whether your doctor will recommend what specifically you should have and need. So like I have a single dorm. I started school during COVID, so that was like very important to be able to like control my environment with exposure to that. So like my doctor wrote down like single dorm, elevator access, air conditioning, those kinds of things. But then when it comes to like academic, like extra time on assignments, extra time for tests, that was kind of sorted out between me and the disability services team at school, and based on what I had in my 504, what helped me before. And you can kind of adjust it as you go as well. So I had like time and a half on tests, but when I had a math class last semester, I was really struggling with the brain fog part of it. So I got like my time moved up to double time. But yeah, honestly, a lot of people, I know it depends on the school. Some people have a harder time in college than like earlier education, but I had an awful experience in high school. I had to do online classes before they were a thing because my school was not supporting me.
I'm
And
sorry.
some legal issues as well. But when I got to college, before I committed to a school, I made sure to meet with the disability services team, kind of get my opinion on how they were taking me seriously, talk to other students. And so I've honestly been way more successful in college than I was before, just because I have a good amount of support now. Like, I did not think I'd be able to be doing full-time classes in person, and it is a struggle, but like what really made the difference was having that support from disability services and professors.
Thank you so much for sharing that. And I can't wait to go back and watch this again and take more notes, because I think as a parent, you're afraid because you're in the middle of just trying to get them through the 504 plan, the IEPs and different things like that, whatever they particularly have. And then, you know, I think there's this fear of when they jump to college, what kind of support services will be there. So I would love to pick your brain more and work with you more offline to see if we can.
I am always happy to collaborate with you. And I do a lot of work with through the Every Life Foundation for Rare Diseases.
Yeah.
We have a specific young adult advocacy group, and there's tons of us in the same situation, kind of bouncing ideas off of each other and speaking at different things. So that's also another resource to look into, and you're more than welcome to chat with me or email me, anyone that has questions or wants to talk more.
Absolutely. I'm very excited to learn more. Armel, do you want to take this now?
Yeah, so I would like to go back from Kate and really answer the question how it varies from day or week to week, because I think it's important to give an idea for any kind of treatments, how we can measure and how often we should measure. So if you care about that.
No problem. And Nicole actually reminded me and touched on something that I've probably been used to for ages, but then don't remember to tell you about the GI side of things. So in the MyRe community and with Josh, GI issues are very, very common. Josh doesn't have constipation as such, and that's a very big problem in the community. But he will experience, after he has food, a very pronounced hard tummy. And he will say, "It hurts, mummy," and we'll do rubbing and all that kind of thing. Luckily his movements are regular, that's fine, but it's interesting to see what happens after food. He will before food have a nice like softish tummy, and then after food he can get this like barrel tummy that's very, very hard. And Nicole's nodding. So thank you, Nicole, for reminding me about the stuff that I'm probably now forgetting and taking for granted. That's just Josh, right? So yeah, I would say that varies day to day. So we will have variances on that. I haven't quite nailed down specifically if that's a food type or not. It kind of is sporadic. It happens more, I think, volume of food, fair to say. It's like an after dinner as opposed to an after lunch or breakfast where there's slightly lighter meals. He definitely prefers to be a snacky child and have lighter meals. But if he has eaten a lot, you see that happen. So that's the one I would say day to day. Other than that, day to day, it was just referencing his fatigue levels, and that will vary on terms of like how he is able to walk sometimes to the school gate, and other times he says, "No, mummy, my knees hurt." So that again varies in terms of his ability to walk distance. And yeah, haven't again found necessarily why that happens, or if he's just having a bad day or he's inflamed or whatever's going on. So yeah, they're my two things. One thing I just wanted to mention on what David said, and this is just for context and not necessarily to chat about now, but losartan is taken by our community, and it might be taken by many people with connective cardiac issues, but there was a pilot clinical trial done in Italy with MyRe patients, and it looked favorable. We need to take that forward, but it looked favorable on some of the fibrosis, stenosis, and cardiac areas as well. So just of note, losartan has been flagged, and Armel, I can send you that research if you'd like to take a look at that.
I was going to say that, yeah, I was on losartan after I got diagnosed for about 10 years, and they're not sure that, and it was recommended by Johns Hopkins to say, we don't know why this slows down the growth of the aneurysm. So we don't know if it worked or it didn't work, but it certainly slowed down from the 4.2 to the 5.1. That took 10 years. So I think we'll call it a success, but we don't medically know why. And it's working for my sister. So that's the thing that really matters. Her aneurysm is stable. So
that's
hopefully
great.
that will continue.
Okay, yeah, that sounds great. I mean, again, sharing that just today from we're using losartan in our community for what it's there for, but also it's looking like it might have other favorable outcomes with that drug use.
Yep.
Yeah, that will be something that we should brought up at the next panel also on treatments and all evaluation around treatments. I would like to welcome someone who is extremely brave, and I'm very honored and impressed to have him with us. That's Aidan, because it's not easy when you're young to share and help the community. Aidan, can you move a little bit closer to your mom?
You'll have to talk real loud too.
So what am I talking about?
Okay, so he's like, so what are we talking about?
So first, Aidan, just introduce yourself. So how old are you? Which grade are you in?
I'm 14 and I'm a freshman in high school.
That's fantastic. So you didn't lose any years in your.
No.
That's great. So I would like you to share about what impacts you the most from your disease.
Probably my eyes and vision.
Okay, that's a very short answer. You're terse, but that's okay. Is there anything else in every day that you see the other kids around you that are able to do and you cannot participate?
Playing football, I guess. There's not really, like, I've found ways around to most stuff from working out and doing stuff like that.
Okay.
Recently, we've only gotten the okay from the cardiologist to do more exercise and not really heavy weightlifting, but more strength, more endurance training, I guess. There were some studies done recently, and they were mentioned at the Science in Paris conference that Marfan syndrome put on a few months ago that talked about the quality of life of patients and exercise. And so it might not be recommended for every person with these rare connective tissue based conditions, but I think it should be a choice between the doctor and the patient for one-on-one. But and I'm saying this because I just want to clarify what Aidan does is not for everyone, but he has been cleared from his cardiologists and geneticists and different people to participate in Taekwondo. He does wear a chest pad to protect his chest from being hit, and he always wears a helmet, and he wears a full face guard to try and keep any injuries from happening to, his head or his eyes. He's actually quite competitive and very good at it. Does his forms and everything with a lot of power and is actually a wonderful fighter. But we're taking a little bit of break from that right now. And as far as Aidan's cardiac health, he had lost some weight and began exercising more. And just as he grows, he's growing in height. We were able to skip heart catheterization. So that's very impressive, and it's very exciting for Aidan. And then I'll let him tell you a little bit. I'm sorry, I'm having to kind of prod along because he's very quiet. But I'd like for Aidan to tell you a little bit about what it was like, because his corneas are degenerating with arterial tortuosity syndrome, meaning they are becoming thinner. And our only chance to save his corneas was a clinical trial at that time. And we had to travel twice to Miami, Florida to have this particular procedure done. So I'll let Aidan tell you a little bit about that.
Yeah, I'm going to mute you, Andrea.
Okay.
Let Aidan speak.
So it was like, I don't even know how to start it. I mean, like,
what was the procedure like for you?
It was kind of weird. There were like clamps on my eyes and stuff, and they put drops on my eyes, and they had a laser on my eyes and stuff. The surgery wasn't the problem. It was like after first time it was like a few days where my eyes hurt extremely bad, and there was like a lot of pressure on them and stuff. But after that, it was fine. And then the second time, it lasted for probably a month and a half of where my eyes were hurting really bad, and it was really hard to do stuff. And I had to miss a week of school.
So did you miss a lot of school, not only for that reason, but let's say in the last 3-4 years, did you miss school quite often?
I've missed it every once in a while. It's not been as often as it might be for someone that has worse conditions than me.
Okay, and do you feel fatigued like the other? Are you tired, or what's your day every day? Do you think that you can follow all the activities or as your peers, your friends?
Yeah.
How's it for you?
For the most part, I can. Some days I get fatigued if like I didn't get like a full 8 hours of sleep or something, but nothing out of the normal range of fatigueness for anyone.
Oh, that's a very good news. And I would like you to share really what worries you the most. What's your when you think about your future, what's your worry?
I don't really have too many worries. I mean, my biggest worry would be that if I went out and started do my own thing and like make money and stuff, that it failed, I guess. I mean, I don't really have too many worries about my future.
That's great. That's fantastic. That's the way you should go in life. Don't worry.
Thanks for speaking with us, Aiden.
Mm-hmm.
Tell them about doing Braille.
So I also have to do Braille, and I don't really like doing it, but I'm good at it, I guess, because I can read really well and I can write it well, and I can like, I guess, translate it, I guess. I don't know, but I've had to learn it because of my vision. I don't really know what else to say.
He started Braille when we found out that his vision was rapidly degenerating, and then as his eyes stabilized with the clinical trial, then we just continued it because we don't know. He's actually the only person in the world that's been studied having corneal cross-linking done the way his was actually performed, and the only one in the world that's ever really been followed with ATS after having corneal cross-linking. So we don't know if his eyes will stay stable, so we continued Braille.
Well, congratulations, Aiden. I think you have a very good spirit, and good luck for the Taekwondo. Is that one?
Mm-hmm.
Yeah, you're going to pursue in Taekwondo, and I'm sure you're going to win a lot of fights that you will have. Thank you for joining us. That's very nice and quite courageous from your part.
All right.
You can stay and listen if you want. Thank you. So you have a great son, Andrea, honestly.
Thank you. He spoke a lot compared to what I thought he would. So that's why I was afraid that he wouldn't say anything.
I didn't want to torture him too much. So David, if you could share a little bit more on how your manifestation varies from day to day or week to week even, that would be nice. Thank you.
Yeah, I think I'm really very stable. Most of it has been medication related because of the arrhythmia, not knowing when I might get a rapid heart rate. And the lightheadedness is what I have to really watch out for. And that's something I never had that problem before. And that's a result. I don't know if it's a surgery, who knows, but it's there now. And you just, as things change, you just adapt to them. But I miss that. I grew up playing a lot of sports. It's interesting hearing Aiden talk about what you can do and what you can't do. I grew up before genetics, right? So my mother would just basically say, just go do. you know, your suit's too big, but you'll grow into it, that kind of thing. So I didn't get to have any excuses, and I don't mean to say that in a negative way. It's just I didn't have choices that I have now, and now I realize what's going on, and I can make intelligent choices, I hope. My wife helps me with that too. But I miss being able to do those things that I always did. So I was a professional bowler in my youth, all through 20s and 30s, and I can still go bowling, but whereas I might do a whole tournament, which might be 40 or 50 games in a week, now I can do maybe 3 games in a day. So, and it's very frustrating to say, well, you just got to realize that's a limitation and you can't do it. But it's hard. So more of it is the mental adjustment to it, that I feel very blessed to be where I am and able to do the things that I can do, having been through a couple of heart surgeries and some other surgeries. It's interesting to look back on all of this and then still try and look forward and do things. So I think it's mental attitude more than anything else. You know, what does tomorrow bring? What does next year bring? What's the next thing that's going to show up that I don't know about? Because there's really nobody ahead of me, right? I'm kind of on the bleeding edge of this thing, and it's like who do I talk to? So what other questions? I think that's probably the biggest one. Is just managing my own mental state and staying positive. And I am a very positive person, but some days are a lot better than other days that way.
Yeah, thank you. I think, yeah, you really fully answered. Thank you for your contribution and your explanations. That can help a lot. Nicole, you didn't specify also, I think you started to talk about a little bit about your class full-time, and but maybe you can explain more specifically from one day to another or 1 week to another. Do you see really cycles, or do you have the feeling that it's random? One day you're going to be good and the other day you won't?
Yeah, I'm happy to elaborate. If I sound a little funny right now, I just took my Zofran under my tongue. That's why. But some days it is pretty random. But I know that, so for example, Tuesday, Thursdays, I have about like 4 to 5 hours of class in a row, with just like a small like 20-minute break in between. So that's pretty hard on me. And so usually I know that the next day I'm gonna have a bit worse pain. I'm gonna be a lot more exhausted. So a lot of it involves like pacing and just being comfortable with like knowing, I might be able to push myself to do this, but it's probably going to have me feeling worse. So in that way, it does vary, but it's a little bit predictable. But other times, I can have been like taking it easy, trying to rest and be easy on my body, like for example, for the weekend or something, and then just have awful symptoms regardless. So it's a little bit random in that way. When it comes to like the pain and nausea, the fatigue is more predictable, just knowing like I have my baseline fatigue, but doing anything, unfortunately, I'm probably going to pay for it later. So that's tricky. Last week I had like a pretty bad migraine, so I had to miss class on Friday, and I wasn't able to do much of my homework over the weekend. So that kind of made this week a little bit tricky for me, because then when I do take time off to try to recover, I'm left with more work, and then that just kind of pushes me back into like cycles with symptoms. So that is a bit challenging. Another thing is like I've noticed, and I've read like a little bit of research on this, which is why I realized that it was happening, is that with menstrual cycles, a lot of times for like some women with connective tissue issues, when the progesterone spikes, it'll make your joints a bit more lax. And given how I already have issues with that, with joint like subluxations, dislocations, I have like sometimes my shoulder dislocates more around that time of month, or I have more pain because my body's just having some hormonal fluctuations that then make my symptoms worse. So that's something I can predict, unfortunately, like each month, about a week of like worse joint pain and subluxations.
Thank you. That's a very interesting point that you just raised. Kate, did you notice any way of predicting when Josh is going to be more tired than usual? Is there anything you notice that could trigger his up and down?
Not specifically, and I think this comes from also the communication side of things. And he obviously has always had Myri, right? And it's not just been something that's happened, and he has a reference point. So for him to be able to articulate to me, also at 5, right, that he is feeling something for a particular reason, I haven't been able to pinpoint that yet. And I think, you know, he might always think that being a bit tired is really normal for him. And you know, I think pain-wise, pain is something that the community talk about, chronic pain. And again, I think it's something perhaps they're used to, which is a very sad statement to say. So no, I haven't noticed anything. He might in future years, and as communication gets better, be able to articulate if something is happening and on particular days. But no, it's much more observational, and it tends to be more random. Generally speaking, he does have a lot of energy. So that doesn't, you know, he's still tearing around with his brother. So yeah, I haven't been able to pinpoint exactly. I would definitely say it is always when it involves walking, walking a distance. That's when he finds things more difficult. Bursts of energy are fine. It's the longevity of what you're asking him to do from a physical exertion point of view, I'd say is the commonality. But in terms of up and down, haven't been able to pinpoint that right now.
Sorry, I unmute. Thank you. And Andrea, I think Aiden went away, but did you do you notice any correlation between with that could explain some variation of his energy or sight or whatever that can explain some modification, even if it doesn't notice it? Maybe you noticed it.
Absolutely. When he was first diagnosed, he was not quite 2 years old, and I don't think that we really understood how fatigued and how held back he was because of the heart enlargement. We didn't originally know that he had arterial tortuosity syndrome, and so it was through the scans and the first echo, or I'm sorry, the echo, and then the first cath that we realized how tortuous his vessels were and how stenotic they were. And after his open chested surgery where they reconstructed the pulmonary artery, he absolutely bounced back. It was unbelievable. We had to keep him fairly quiet, you know, after having open chested surgery. And when I think he was only in the hospital 5 days, which was unbelievable. We would have to take him to the movie every single day just to be able to keep him sitting down and quiet for periods of time because he had so much energy. We were afraid that he was going to, hurt himself, overextend himself or whatever. And the really interesting part is those with ATS often have tracheomalacia or issues like that. And so after he did have a lot of swelling after they removed the trach after his open heart surgery, and his voice changed from then on out. I don't know what happened, but there was a lot of swelling. And when they extubated him, that was, I don't know, that may not mean much of anything to anybody else, but that was something we thought was very odd, that how his voice changed and deepened. And, but yes, I can almost tell when we go for our 6-month cardio visits and he has his echocardiograms, I can tell Dr. Fontenot what I'm feeling. And so now it's kind of a game like, Andrea, where do you see us going? And then Dr. Fontenot will tell us what's on the echo. But I can pretty well tell Aiden's fatigue level and when we're going to need to go back in the cath lab to have the stents enlarged or, more ballooning or whatnot based on Aiden's activity level. But we've been very lucky lately that, he's in a pretty stable spot right now, cardiac wise. But we will continue to have those things happen. And as far as his vision, he does have an IEP. He does have issues with the way that the light glares. It's lots of little things. We've done some vision training, and we've got videos, A Twist of Fate does, that we've done lots of educational videos on things like that. So if anybody's interested, you just don't really think about it if you don't have those issues about the way the light hits your eyes and it reflects the light off of your corneas. It could depend. When he's reading, he actually should have like larger print to read, and so he has those accessible at school. He has his own Chromebook that has different lighting as far as the way the light is on the Chromebook screen. There's just lots of adaptive things that they've done to help him be able to be as successful as he can in school. But he does tire often, and he does need, and it's more his vision that makes him tire than anything. He gets very fatigued with his eyes.
Yeah, I'm not surprised. That's 80% of your energy goes through your eyes, in fact. So I'm not surprised that when he doesn't see very well, he's more tired than when he sees properly. I'm sorry, I sent him books. I'm so stupid.
No, he can read them. No,
Okay.
he loves them, and he can read them. He does have magnifiers and different things that he can use to, adjust. And yeah, I mean, he reads a lot, and he does. And I can't remember who said it, but I think it was probably Kate about her son. That's why I was afraid to have Aiden on, because I was afraid he wouldn't say very much, because he doesn't consider it a disability to have ATS. He has conquered it, and he's not let any of the medical things that have happened to him hold him back. There are some things that we have to kind of help hold him back on. Some things like football is just a no for us. Like, that's just not we're not taking that risk. I think he would like for us to let him take that risk, but there's just some things that we've always taught him that everybody has something wrong with them, whether they're a healthy person or not. They may have a bummed up knee, or they may have back issues, or they may have a hair color they hate. There's something about somebody that they feel is wrong about themselves, and we've never allowed him to use it as a cop-out not to try to do things. So he really just doesn't feel like there's a lot to talk about sometimes about ATS, if that makes sense.
Yeah, and honestly, all my colleagues, the neurologists, none of them would allow their kids to do football. So he's not the only one that has this kind of frustration, because all the other kids do it. So don't worry, our son doesn't do football either. I think if someone wants that was not talking on the panel would like to react and add something that was not mentioned by the panelists, that would be the moment, or even people from the panel, if you think that there is something that we missed, or something you would like to talk about, not the treatment, because that's the next panels, but something else that we didn't address. I don't know, there's Tammy here, or Ginger, or Maya we didn't hear. So if you want to comment and share also your view on those questions.
I've just really appreciated hearing everybody's stories today. So thank you very much for being willing to share with all of us.
And do you have the feeling, Maya, that Nicole's story is similar to yours?
I mean, there are some differences. I don't have, the same GI issues that Nicole has, for example. But, I have similar issues with showering or standing for a long time, doing the dishes, things like that. Because of the issues with my dural ectasia, I have to be careful about bending, and especially bending and lifting anything. So my physical therapist had me get a walker when I started graduate school, so that I'm using that to cart around my backpack and, lunchbox and things. And then also so that I have somewhere to sit. So for example, I have to give 2 presentations in class this week, and one is 5 minutes and one is 15. So for the 5-minute presentation, I think I'll be okay to stand, but the 15-minute, I'll have my walker up at the front of the room so that I can sit down and give my presentation seated, because otherwise I'm going to have trouble just with pain for days afterwards. Just try to keep the inflammation in my lower back to a minimum so it doesn't irritate the cysts that are there. And there are other activity restrictions, which affected me more when I was younger, not being able to do certain sports or things like that, which I care less about as an adult. But I had 2 smaller artery dissections in August. I had a spontaneous coronary artery dissection and a vertebral artery dissection, which are uncommon in the Marfan syndrome population. They're much more common with some of the related conditions like VEDS or Loeys-Dietz. So I've had to adjust the medications that I've taken and kind of further adjust some of my activity restrictions as a result of those dissections. So adding a second blood pressure medication, things like that, blood thinner. So I'm adjusting to not being able to take NSAIDs anymore. Figuring out different ways to handle pain since NSAIDs were a big part of my pain medication regimen.
Thank you. Thank you. Yeah, that's important. That's another part. That's there is the thing is that in those rare diseases, there's a huge heterogeneity in the manifestation also, and in the kind of manifestation and the strengths of the manifestation. So it's important to pinpoint that point also.
Yeah, even within a family, which is something that we talk about. I think that surprises people, but like my son, who's also affected, uses a wheelchair part-time and he used a stroller, and then once he got to kindergarten, we got him a wheelchair, and that's not something that I have to use very often. He had more severe lung issues than I did, but I've had a bunch of surgeries and he hasn't had any. So there's still a lot that we're learning about how, even though we have the exact same change to the FBN1 gene, our manifestations are different.
Yeah, that's common to many different rare diseases, that there is no genotype phenotype correlation, or very poor genotype phenotype correlation.
Yeah, kind of going off of what Maya said, both my mom, my sister, and actually my aunt have Marfan, and we all kind of struggle with different things. But one similarity, my mom never had like severe scoliosis or operation for that. Me and my sister both did. We both had surgery when we were like about 13 or 14. My mom didn't have that bad heart issues until she was an adult. I haven't had that bad heart issues. My sisters are a little bit worse, but neither of them have GI issues. So it's just it's like Maya said, there's definitely some similarities, but even within the family, like a lot of times when we go to certain specialists, it is like we're kind of on uncharted territory, or learning something new, or learning to manage different symptoms, just because we can't build the pattern for what Marfan looks like even within our own family.
Thank you, Andrea. There is something that strikes me, is that Aiden doesn't seem to have any muscle weakness.
He does to an extent, but not as severe as some of the other similar conditions, or maybe not even as severe as some of the other ATS patients, going back to that genophenotype. I think it really depends on the variants that are involved. Aiden is definitely much more severe with severe stenosis of the mid to large size arteries, and the tortuosity is very severe. But it does not affect his muscle mass as much. Now, he does not gain a lot of muscle. It's almost like he has a longer muscle, maybe, where I have more short, compacted muscles. I would gain muscle mass easier than he would. He can tone, but he just does not gain mass, if that makes any sense.
Yeah. totally. So I think, Andrea, you wanted to add something on the carrier.
I did. So ATS is autosomal recessive, but we are finding, actually in 2014, when I started the nonprofit and started gathering patients a couple of years before, the parents all started talking about similar issues that they were having. I've had multiple back surgeries. I have severe degenerative disc disease, lots and lots of muscle aches, fatigue, and you know, everyone talking about having trouble with standing at the sink, cooking, or doing things like that. I'm actually glad that you guys brought that up, and I'm thankful, because to me that was embarrassing to actually talk about that publicly, because I thought it was just me. But I think that there is something that has to do with the way our muscles and connective tissue support ourselves, that it makes perfect sense that that is an issue. And you know, I'm 43 years old, and I'm having you know, having to do physical therapy because I'm having so much muscle pain across my lower back and across through the front of my hips that I cannot walk long periods of time. And standing and cooking is absolutely excruciating. Washing dishes, I'm good for about 10 or 15 minutes, and then I have to sit down and take a break for a while. So there's lots that we need to learn about carriers for arterial tortuosity syndrome. That's just not been published yet.
Andrea, I hate to interrupt, but have you seen the organization Remember the Girls, or heard about
Yeah.
Taylor? Yeah.
Absolutely.
I was thinking about her, and I'm like, so much that she's trying to push for research in carriers. It's
She's absolutely phenomenal. And one of our partners on this project is Jade Day. She was sick this morning, so she couldn't join us, but she is part, I think she's on that board of directors. And what she's doing for, you know, X-linked carriers is absolutely phenomenal. She's a very young person and amazing.
Yeah, she founded like the young adult group I'm in, and with Every Life Foundation. So it's super cool to see all that research and advocacy being done.
Absolutely, she is fantastic. But I'm kind of, there's just not enough emphasis on carriers of these autosomal recessive conditions or the X-linked conditions, which I think is very sad, because we're essentially suffering in silence, because our, you know, as you become an adult, it's harder and harder to get your providers to listen. It feels like that there's so much more around pediatric rare disease care and specialty. And I think that's one reason why I really wanted to say something on this call, because I feel like that's an area that is very understudied and very misunderstood, because we do have the same, maybe not the same characteristics as having the full condition, but we do have joint pain and we do have muscle aches, and we should not have corneal cross-linking done if our vision should change. And there's things that we are learning, but without it being published, we have no voice, and we're just suffering in silence, really. So thank you guys for listening to that part. I just hope that will change, and maybe I can work with Taylor a little bit. She seems to have quite the advocacy game going for carriers, for sure.
Thank you, Andrea. We are getting closer to the end of the panel. I don't know if the people that join later want me to go through the initial presentation of the slides I had at the beginning. I don't know, Dave or Tammy.
I would be interested. I don't know that everybody else needs to sit through that again, but I'm happy to. And, you know, I hopefully the next meeting I'll know about.
No, sure, I can do that. And so just before I do that, I will say that from today, what's really stick out to me is that everybody has a problem with fatigue. Maybe less you, it's more like lightheaded, but fatigue is the main burden every day. And the worry is more about, of course, life-threatening conditions, and maybe the future and the uncertainty of the tomorrow. So that's where maybe we can emphasize for the future webinars to deal about those kind of issues. And yeah, mainly the specific activities are around the limitation in mobility, and in mobility, I would say also for Aiden, for example, his eyesight that decreases will also impact his mobility and his ability to participate to daily life activities. So I will make a deeper analysis of everything, and joined with the results from the survey in the first webinar we'll have in November. We'll have conclusion and analysis of today. So I will share my screen again, and where is it? It's here. And go through the slides again. So go back. Why can I go back? Okay, so so for the one who were not there, and sorry for the others, but it's maybe I went too fast, and it's always good to have a second time. So what we call CONECT, it came from Cardio-Ocular Network of Connective Tissue Disorders. That was today our first panel. So what we want to achieve is to build a cross-cutting rare disease partnership among connective tissue rare disorders. Obviously not the hundreds of different connective tissue disorders that are known, but the one that focuses on the, if you could mute, I don't know who's on the,
I can't see that.
Hey, Jade, could you mute yourself, please? Thank you. So yeah, we focus on connective tissue disorders that have cardiac issues and ocular issues, but we are not going to talk only about that. But that was a way to screen and select the different disorders. So we want to address the common limitation and challenges. We want to align the medical care with the medical need according to the patients, not according to the clinicians. And we want to empower the patients with appropriate knowledge for an efficient dialogue with their clinicians. I want them to, we want also to identify and disseminate specific and differential training for medical staff that are confronted with connective tissue disorder, especially for the training that is necessary and the knowledge necessary to address specifically connective tissue disorders. We want to inform PCOR priorities and select PCOR priorities, and so new research center on the patients, because we think that patients that are better equipped to dialogue and describe their manifestation will trigger attention to new aspects of research. The differential training can identify gaps in outcome measurements or unexplored manifestation, also from the part of the clinicians. If they are talking about what to measure, maybe they will identify that we need new technology to measure it, or that can lead to new research. So our objective is to use virtual convening, listening to patients' voice, to explore patient needs and answer the challenges and make proper medical decisions. We are going to use expert clinicians analysis to create the content of masterclasses for clinicians and physicians in general. We want to create a partnership and disseminating platform including interactive webinars and a hotline to share observation and informations. So what it means, in fact, is that the CONECT platform works with, we are in the first part, with patient survey, panels, convening of patients. On the other hand, clinicians and patients involved in the analysis of the techniques and the knowledge in clinic and scientific literature. We look at those data through the screen of being always with the cross-cutting analysis, and we want to improve care, educate, and identify new research. So with this lens of screening, we should be able to have an interactive patient education webinars and clinician education on technical education with interactive masterclass. So from those webinars that are supposed to, where we are supposed to get feedback also, that the discussion can trigger new research ideas that will go back to the whole loop, in fact, and the system should feed itself for the future. So the impact we want to have is the interactivity of the model is extremely important and will allow to adjusting the focus of cross-sectional issues in similar rare disease community and address patient needs and evaluate peak or priority and lead to new research. And the platform will have a direct impact on awareness and in the clinical community, and an indirect impact through the increased ability for the patient to advocate for themselves. So later we want to implement the new research, the new studies, and we want to create a partnership and disseminating, including interactive webinars and, oops, that's not the one, that's the one. So the new SARE will lead to more information in the rare diseases, leading to a stronger community that makes more informed decisions and healthcare that will increase an increase in the healthcare quality will increase the quality of life. So that's basically the idea in 3 minutes of the CONECT platform. And we started today with the first panel. So I'm going to stop sharing. So does anyone has some questions, remarks? Oops, I'm muting myself before I finish. Remarks and suggestions to improve the thing, or not to change it too much because we have a limited budget, but I don't know if you have any questions. We're here today.
When is the next meeting and what time?
You're on mute, Andrea.
That mute button either gets you in trouble because it's on or off. It's neat. It is February the 4th, and it's the same time, 9 a.m. Central Standard Time. And I apologize for the time, but it was hard to capture those that were on in like California and be able to capture those that are in Europe. So we wanted to keep it as visible as possible. But everything will be recorded and it'll be hosted on the Twist of Fate website. But we also have a YouTube. Later through the project, we'll share the links once we've been able to review the recordings. And I hope that you all enjoyed yourselves today and what you were able to tell us about your story is very impactful. And I hope that you'll share that with others in your community about what the project is. I think it's very hard to have a one-page flyer and be able to really tell what the project is and how impactful that it can be for our communities. And remember, at the very end of this is to bring all of the communities together, the patient group leaders, the patients, the scientists, the doctors. So we're all working as one team to better combat these rare connective tissue cardiology-based conditions.
I just want to add, say again that in 2 weeks, so the next one is February 4, I think, Andrea.
Yep.
And it will be on the treatments. So the current treatment you have, any comments on how you deal with the treatments and what you expect from a new treatment, and which kind of concession, or what are you ready to do to get a new treatment? So in terms of, are you okay to drive 200 miles to get a treatment? Are you okay that the treatment would be IV? Or this kind of things, and what you expect from a treatment, really. Do you want the treatment to act more on your fatigue, more on your lightheadedness, or this kind of thing? So next time is really, this time was more personal on your life, and next time is really to explain to the FDA or the pharmaceutical industry how involved you would be in a clinical trial, how involved you would be in trying a new treatment. And it's also important for your community and your scientific directors in your organizations to know in which direction they should go. And for us, it's also a way to inform the clinicians and the patients on where they should increase their knowledge and where they should focus. The third one will be February, 18th?
February, let's see what that date is. I believe it's the 18th.
Yeah, I think it's 18.
It is.
So the third one will be on the knowledge and how you feel that the clinician or the physicians, the different type of physician you talk to, do know or do not know about your disease, where we should increase the knowledge or the awareness, in which category of physicians. And on the other hand, where do you feel that you don't know enough to explain what you feel, where you should increase your information to be able to really dialogue with the physicians you have in front of you, or how to explain your disease, or this kind of things. So that will be the third panel. And that's it. I think we're just on time.
Well, good. I didn't get the first invitation. That's why I was late. So I'm not sure why I didn't get it until you sent this morning when you sent me the link.
Oh,
I am so
I'm not
sorry.
sure why I'm not, what happened. I knew about the panel, but I didn't get any of the follow-on information. So the timing is fine. 10 o'clock Eastern on those dates is fine. So as long as you send me the Zoom link, I'll be there.
Absolutely. We will make sure you are on that email thread, and we'll get you taken care of. We really enjoyed your story, because it's not very often that you hear from people that have one of these conditions that was diagnosed later in life, and you've led an amazing life. So that just shows it doesn't always have to hold you back.
Right. I think that's one of the things that I always say is that knowing now what I knew, I would have been precluded from doing a lot of things that I ended up doing. And I think you got to be careful, especially as you grow into adulthood, to make decisions for yourself as to what you can and can't do. And I don't know what decisions I would have made. I would have never been able to, go to flight school because they wouldn't have let me in, knowing the condition. That just wouldn't even have been a possibility. But it turns out that, you can do a lot more things than people are often aware of, that you have to figure it out as you go along. I think it's hard. Everybody has their stories and different manifestations of this thing.
Absolutely. Well, we appreciate you sharing, and we'll definitely make sure that you have all the advice that you need, because we definitely want you to come back. So.
Oh, great. Nicole, where do you go to school? I was curious. You said the Midwest.
Yeah, I'm in Illinois. I'm in the Chicago suburb, North Central College. It's a very small
cool.
private school. Yeah.
One of my stops was in the Midwest, so I was just trying to see if I knew where. No, I was in Des Moines and Omaha, so further Midwest.
Yep, further into the cornfields.
Further in the cornfields and the cold and Anyway, thanks, guys.
Of course, nice to meet you.
Same.
Okay. Thanks to all of you, and hope to see you at the next panel. And thank you for your time and all the personal things that you shared with us today.
Thank you, Armel.